Okay, then when we're going to get started, I do notice that we have at least one person who's on the audio portion who is not on the web portion. To go to the web portion, use the same code of 8450112, and you go to www.readytalk.com and put it in there for the participant code. And other than that, we see that most people are on. And so allow me a moment to introduce today's topic. Well, actually, right after I introduce Jessica Pancoast, who's the head of our help desk and our training teams. And we've been on these webinars now for, I think, right around 6 months, talking about various ways that practices can become more efficient. A lot of times we're going over features that people didn't know exist, or more complex features like care plans that perhaps people aren't using correctly. And we got some pretty good feedback that I remember from last week. I didn't know this existed. This is so much easier. And that sort of stuff is certainly very satisfying, and we're out there to help in any way that we can. Today is a little different in terms of showing you specific features, because today we're talking about features in Vericle that span the entire patient life cycle, all of management. Today's topic is, what is it that Vericle can support? And we've had some practices who have worked with us over the last 5 or 6 years to develop a lot of our features and the different tools within Vericle to actually accommodate practices that want to become multidisciplinary and have more than one specialty built, scheduled, and utilized within their practice. And we even had a couple practices that left us. And, upon their exit interview, we would ask them, hey, why are you going? Well, I didn't realize that you guys could handle my MD, my PT, my weight loss, and my chiropractic. And, a little unfortunate in some of the times because they'd already, let's just say, signed contracts and dropped dollars on new systems. But today we want to make sure that everybody knows that we can support you and what it is that we've done to make supporting you a little bit more realistic. And so Jessica and I today will go over the finer points of that. And so if you are out there considering ways to drive more revenue, retain more patients, oftentimes you'll see that offering more services can be the best way to do that. But you want to make sure you have a platform that will actually support that. And so today we're actually going to go over that, not necessarily top from bottom, but the key features. This is an outline of all the things that we're going to go over. First of all, from a high level, what problems do people who want to integrate other specialties in their practice, experience? What do they encounter? This is by no means a comprehensive list, but even in discussing it with some of my colleagues, you can put a lot more on this list, but here are some of the big ones. Then we're going to go through how we address those from the following standpoints: scheduling, documentation, billing, reporting, and management. So let's dive right into the problems. We put a list of 8 here, and these problems are, I'll just come out and apologize for being a broken record up front, Jess. A lot of these problems have to do with the way that either other systems or even our current clients want to utilize a single patient account. There's a lot of different ways that we can go about this, and 2 of the biggest problems that we encounter are multiple patient accounts versus single patient accounts. And so how are you going to keep it all straight? We know that we've got friends who use other very popular systems that have multiple patient accounts. Patient walks through the door and wants to know what their balance is. If you've got multiple patient accounts, rhetorical question time, how do you get them an accurate balance quickly and efficiently and accurately? How do you post payments on one account versus another? Jess, I'm almost certain you don't want to run 4 credit card transactions for that person that day, do you?
No, not at all.
Not at all. And as a patient, they typically aren't excited about that either. So we're actually going to touch on this in every single aspect, because a lot of times you don't think about how another system will be able to support multiple disciplines, and a lot of them recommend multiple patient accounts, and I want to be able to make sure we understand that. Documenting. How do you make sure that you keep your documentation straight between all of the different specialties? You know, let's just say your massage doesn't need to have day-to-day documentation for all of their patients, but for some of them that you're billing to insurance, you do. How do you keep the chiro notes separate from your MD or nurse practitioner notes? Say we want to show you that. The next one of shared subjective. If each person has to ask a patient on that initial eval why they're there today, you can do a lot to damage the initial experience that patient has at your clinic. And so we want to make sure you understand that we are not just looking at this from, hey, we can help you to make more money. If you don't take into consideration that patient experience, you're not going to be able to retain that patient either, and everyone loses. When somebody has to reschedule or misses an event, how do you manage all of those scheduling events? We take that into consideration for your front desk and office management staff, and so we want to show you how Vericle would go about answering those questions. Care plans is a big one. Up to date, and only recently, Jess, I think you might be a little bit more well-versed in this than I, you can only have one active care plan. And how on earth are you going to manage 4 specialties with the potential of 4 care plans? So we want to show you to a certain extent of how you can manage that with your patients and make sure that all of your clinicians have the ability to implement schedules and ultimately charge the patient the right amount. The billing, we get lots of questions. I'm going to be billing out under one tax ID number, 3, 4, sometimes 5 dates of service under the same day. How am I going to avoid bundling claims? How am I going to keep them all straight? And here I'm actually really excited to show people about what it is that we can do to help them with that. And if you've got, let's just say, multiple patient accounts, how do you track new patients? How do you track a no-show? Somebody doesn't show up to one of your visits, you're going to have 4 visits. How are you going to use reporting versus other tools that we're going to show you today to manage that? And so these big problems are things that we've heard practices voice to us over the last 6 years that say, I can't use another system because of this. And the last one, the insurance verifications and authorizations, not necessarily I've heard something that didn't go well in another system, but just recently we added functionality where we can actually show you, you can add multiple referrals and auths now to accommodate multiple specialties. So this is a portion of what we've done to help address the major problems that practices have brought to us. So to break this one down in scheduling, and again, the broken record part of me, for years, clinicians would be creating multiple accounts for patients that would come in for their physical therapy versus their chiropractic versus their nurse practitioner who wanted to give them some trigger point injections. These problems can be really hard because now your front desk has to make sure that they're choosing the right patient account.
I've had many practices reach out and say, that they are using the multi-specialty, the multi-point accounts, and they say, oh, I billed this under the wrong one. How do I move it over? And it's just a manual process, basically re-billing the claim under the correct account and moving over the money.
Sure. And so that part's tedious, being kind, right? But we had to make changes in our system to help you as the practice owner, the front desk person, the office manager, utilize a single patient account. So we had to go back end of the code and actually make changes that would allow you to do this. And those changes for scheduling were minimal. You didn't have to do much there, but to allow you to use one patient account, we had to make sure that we're able to track things. We're able to have the documentation thread for multiple specialties actually work under a single patient account. So we'll tie all this back in together in a few minutes. Appointments that needed to be rescheduled, we actually found this pretty cumbersome. Let's just say Jessica was a patient who got a flat tire or whose child had to be picked up from school early. They call up, they're respectful of your time and your cancellation policy, but they didn't have a choice in the matter. The tire's flat or the kid needs to be picked up. There's nothing you can do about it. They would call up and say, can I come in 2 hours later? Now your front desk person would have to go in and change each appointment. Not anymore. Now we can show you actually how you can go in and reschedule one of those appointments and then choose a button to reschedule the same appointments within that block and move them all either 2 hours later or till tomorrow or to Thursday, whatever day that you want to put those on. It sounds like a minor change, but no-shows happen. Reschedules happen, and if you have to spend more time, all those clicks add up, and they make for frustrated staff and for a larger likelihood of errors. All right. The check-in kiosk, this is a big one that allow somebody to check in for all their visits as opposed to just one. That's a new change. That's not too recent, though, is it?
Well, we used to allow them to check them all in, but it was a setting and it was just all kind of on the back end. They couldn't see it.
Okay.
Now we list out all the appointments. They can either click the all button, which will just check them all in, or if, they only have time to do one of their appointments a day, they do have to cancel the other one. They can specifically check in for one of the appointments.
I can't stay for an hour and a half today. I've got to leave after an hour.
Right.
Something
came up, I can't stay. I do need to cancel that second one, but I can check in for that first visit. So now we list on the check-in kiosk, we put their name and we put the appointment type, and they can choose which ones or all to check in.
Perfect. So again, the one schedule listing all appointments regardless of type. I didn't actually add this one, Jess. Is this where we have a clinician? That clinician has a schedule. You put that patient on the clinician's schedule, and then you have another clinician that they're scheduled with. Are you able to combine all of those under one view now?
So on the patient account, on the Schedule tab, in the patient account, it lists all their appointments and the clinician they are scheduled with.
Perfect.
Also, if they print out, there is a patient's calendar option up the top where they can click and get a calendar view of all their appointments, and they're all listed on one calendar.
Great.
Or one list, depending on how you want to print it out, rather than multiple.
Awesome. Perfect. So, and then on the end here, I simply reiterated the problems of having multiple patient accounts, and I put it under scheduling, even though it spanned a couple of different topics here. If somebody walks through your door, it's pretty reasonable that they're going to ask you, hey, what's my balance? With a single patient account, and I'm happy to demonstrate this in a couple of minutes, you'll simply bring up their patient statement. Anything that's in patient responsibility at that point will be there, and showing them that balance is fairly straightforward. If you have multiple patient accounts, you've got to then start the search, and you're going to have to manually add those up. And I would seriously urge anybody considering to use any other systems to ask these questions during any sort of demonstration phase, and the answers are startling. So if I put staff problems here as the second one, your staff is going to make an error. It doesn't mean that they're not committed. It doesn't mean they're not trying really hard. But if anyone's ever worked a front desk, and I have, you know how busy it gets up there. They're going to choose the wrong patient at some point. There's only one patient to choose from. The likelihood goes down quite a bit. And again, balancing those accounts, patient comes in, runs a credit card on one account for $200, and now you've got to reverse out some of the money and on one account and put it over to other accounts. I have two unfortunate words for you in there of a sarcastic nature. Good luck. It's a real challenge to do that. And one thing is, patient reminders right now are still something that we're ironing out on our end. I just thought I would bring that up in a real straightforward way. We don't have the ability right now to send out just one reminder for the 4 visits. It's something that our development team is actively working on right now. So keep that in mind. That is something that I would say is not perfected.
Right. It only works if they always have the same appointments and one of them is always first.
Yep.
You can turn off the reminders for the other types, but that's really the only solution at the time.
It's the only solution, and what we found is it's prone to errors, and we very much want them to get reminders. So we are working on that actively right now, but full disclosure, we're not perfect either. So I just figured I'd bring it up, Jess.
Okay.
Perfect. So documentation is actually something I'm always excited to talk about because, you know, all the clinicians that hear this, they liked what I said in the scheduling, and they understood that there were problems, but this is what affects them. We have to save time. Saving time is one of the biggest things that we hear all of our clinicians are talking about. And again, this is where I really feel like we have a leg up over competitors. The magic in our system is that when you log into a visit that's not the first visit, it's going to bring up an exact copy of the previous visit. Now, what does that mean if you're a chiropractor and the last visit was a physical therapy visit? We have the ability to customize this so that it's going to bring up the previous date of service by either your specialty, or if you don't want to do it, you can bring up the last PT note if that's the one you really wanted to see in your chiropractor. Not many people find that one useful, but those particular portions. So if you're an MD, you're a nurse practitioner, you're a physical therapist, you're a chiropractor, you don't want to see the other threads of notes. You want to be able to log in and pull up both the CPT codes, the diagnosis codes, and the exact note, a copy of the exact note that was billed out by the last person, either that was you or the person in the office that was your specialty. This saves time. You don't have to go search it. You don't have to click make a copy. This is automatic. You then make your changes in the subjective, qualifying and showing that there's been steady progress on the patient account of them getting better. You're then able to build that visit out very, very quickly. The other thing that saves time, especially when there's evals, or really only when there's evals, right? Because this, the next one, the shared subjective, only works on the first visit. Correct, Jessica?
Right. It only will pull across specialties on that first visit, and it only pulls the subjective with that option.
Perfect. So patient walks through the door. You can't guarantee which specialty is going to be the first person to see that one all the time, right? You're not going to make a patient wait while the chiropractor finishes up another evaluation. Typically the physical therapist or whoever else is working that patient will go and start treating them or conducting the evaluation. You're going to ask a whole bunch of questions about how the patient's doing and why they came there. You don't want that experience to be repeated across all the specialties. So what our development team has done is we've heard the concern, and they are going to populate those subjective complaints in our XMR technology, which is our main platform for documentation, across all those specialties. So for the first visit, it's simply something that the clinician is going to read. For the subsequent visits, they're going to have to update the progress that patient is making when they complete theirs. Puzzled look, Jess?
Actually, I'm not sure anymore if it's only on the first visit.
So it could be more?
I'm thinking of where the setting is and the phrasing of it. I think it might always carry over to subjective.
Oh, okay.
I think so.
Well, I'll tell you, I would love to get confirmation for that on the end of before the end of the call. That would be great. It's one of those things that does save a lot of time. I know it happens for the first visit. If it happens all the time, actually, that just keeps getting better, doesn't it?
Yeah.
Okay. Perfect. If you want to go find out, that'd be great. I'll continue here. That amount of time saving isn't necessarily to benefit the clinician. I know it does, but I'm certain in that it benefits the patient. And that's how the concern was always brought to our attention. If we have to interview them 3 times, it doesn't look like our multi-specialty practice has a coordinated effort to serve that patient, all right? We then have the XDoc platform, including a library of outcome assessment tools, evaluations, and we have other forms, and I'll give you a couple of examples of those other forms. Work excuses. You have to get somebody, out of work with an official diagnosis of, this person hurt themselves on the job. I'm the clinician that's saying that they're suffering from this particular ailment and they have to be out of work for, so long. Coordinating with your front desk to print that out can be somewhat of a challenge. We have a library of these forms available. Jess, what did you find out?
I did check with Devin. They did say it was just the first visit.
Just the first visit?
Yeah.
Okay, great. So these XDocs are there, and they become part of the health record as well. So those outcome assessment tools and evaluation forms, the evaluation forms are particularly useful for very extensive questionnaires, such as your auto questionnaires are really useful in there because you have to ask so many specific questions, and they act as a guide to make sure that you don't forget some of the critical information that has to be gathered in order for you to get paid by insurance companies, when they request that documentation. So we have those libraries, and they're not just for chiropractic. We have those libraries, and they really cover a spectrum of specialties, some of which you might have to pay for because we have clientele that have come in here and built sub-libraries that are for sale, some of which is available for pretty much anybody who wants access. And there is, even on a limited basis, the ability to build a form if we find that form will be useful across our network. We'll go ahead and spend money on resources, but we can't guarantee that we'll build every form that needs to be built for our practice. So that doesn't mean we won't do it, but we might talk to you about a price to charge for that. So you'll notice again, Jess, that I brought it back to single patient account. One account means all the notes for all the visits are located in one place. So if an adjuster, actually, we have a mental health clinic that has a couple different specialties in it. And while our team was out there last Friday, Blue Cross Blue Shield quite literally knocked on the door. They didn't know they were coming. This is a relevant anecdote because we do hear of this. And they walked through the door and asked for patient records right there. And it was reasonable that they asked for them. And this office was able to go to the documentation tab, grab all of it, hit the print button, and they were able to package them up right then and there and submit them to them. So one account means ease of finding that documentation without having to go search in multiple places and making sure that you have it all. It is a very, very simple way of doing that. As well as your personal injury, or any cases where you actually have to mail notes on a regular basis, having all of them in a single place is always the best. And you can sort those and filter those based on clinicians as well, so that if you don't want to include the massage therapy or the chiro notes for your MD request for notes, you can just send those as well. So it does make it simple for you as a practice owner to see the notes, and then as the support staff to find the right documentation to send, because let's face it, documentation needs to be sent. It's just not anything I don't think anyone's going to get away from real soon. Please. Okay, I already mentioned this, Jeff, that it pulls over the previous diagnosis codes and CPT codes. I want to reiterate it here because this also follows the same logic of only pulling over the last notes for your specialty if you customize it that way. So that as a covering, let's just say, MD, you don't have to go choose all of the diagnosis and all of the CPT codes again by reading previous documentation, which will simply slow you down. You can read the current note, very simple to see which codes are being chosen and are proposed for being billed out. And if no changes need to be made, you've saved yourself a lot of time and energy and reduced the risk for error.
Yeah, and for these, again, we can do it single specialty, cross specialties, or cross specialties only on that first visit.
Very nice. That I keep forgetting. So thank you for pointing it out. Again, I put this one statement down here, which I already mentioned when we were talking about scheduling. The reason I added it here is all of our personal injury, workman's comp, those types of payers typically don't want to see a patient statement. We have other types of statements as well. And those statements, when you want to send them out, simply have to have a ledger of each date of service and what was billed for those dates of service. And we have those ledgers as well. And those things are really exciting. And you're giving me a look. We use these all the time in the fin tab.
IDD summaries, yes.
Yeah, okay. You gave me a look like you didn't know what I was talking about. And These, if you're not using these right now, really do make it a lot simpler for you to send to an attorney or sometimes even just the adjusters over at these particular payers to get them a full breakdown of what was billed out for all these patients and what was paid. So if you have multiple specialties in there, it simply makes it that much more challenging to do that. So it's not just the patient who benefits from having a single patient account. It cuts down on a lot of work and makes it much more easy for anybody who needs to see these to see the magnitude of all the work that was performed for that patient. The practitioner legend to show which practitioner charged which services.
It's a setting. Basically, at the bottom of the statements, we can add each of the clinicians' names that saw that patient.
Perfect.
With a code, usually the first and last initial,
okay.
And then through the entire summary up at the top, next to each charge will be that initial, so you can see which clinician charged out which service.
Great. And that can be helpful in a couple different scenarios I can think of, but without it, it's a lot of manual work, right?
Right. Well, it also has the clinician's NPI.
Okay.
So sometimes if the owner of the practice, their information, the practice information will be up at the top, and then you're sending these statements to insurance, and they want the actual clinician who saw the patient, they want their NPI. So this is a way to get that to them,
right.
Just adding it right to the statement or the summary.
Number 4 is repetitive from what I've said already. Patient walks in, you've just simply made their life a lot simpler. Typically, you'll have a balance in the schedule that will say that the patient owes, and you run the credit card for $100, whatever it ends up being, and then that patient is paid and it allocates across all the balances, and you don't have to do anything. It's fairly straightforward. But a lot of times the patient will ask, well, why do I owe that? That answer needs to be concise for a solid patient experience. The services you provided had value, and if you were able to explain it easily, that value usually is retained in the patient's mind. The second you can't, doubt creeps in, and we see that patient's perception of the practice goes from very high to very low very quickly. So I can't reiterate that enough, because my interaction with a lot of the practices has been, I can't afford to get the answer to that question of what do I owe wrong, or I can't even hesitate when I'm answering it. I have to be able to show them very clearly why we are charging what they are charging. All right. And again, number 5 is a little repetitive as well. Our referrals and authorizations can be specified per specialty, and so they will attach to the right claims, which we're trying to automate as much as we can automate here. We do not want to have anybody unnecessarily eyeballing a claim before it has to go to an insurance company. If the authorization is there from the MD for the physical therapist, then it should just simply attach to the physical therapy claim by specialty that's going out. I really don't know how to simplify that one anymore. If you're spending time doing this, we think you're wasting time. All right. And if you have any questions, I should have mentioned this, please chat them in, and we'd be happy to answer them. It notifies us, right, when somebody's got a question?
No, I actually have to open it up.
Okay, got it. So reporting here, and I believe this is our last slide, if I'm not mistaken, management is. So patient shows once in reports. So if you're going to run any reports in our system, it's always going to be based around a patient account, right? The visit count would be exactly the same, but if you want to count new patients, if you have 4 patient accounts, you are unfortunately counting that patient 4 times when you really only had 1 extra patient come through the door. You had no-shows, well, you've got 4 no-shows. These are the types of problems that we're talking about when we're talking about multiple specialties. You need to be able to track by specialty, which you can very simply do. It's one of those configurable reporting items within our system to be able to pretty much run any of our major reports by specialty. And you can run it by the rendering as well. And those referral sources are the big ones that our multi-specialty practices want to be able to compare. The patient retention tools, this is a big one. Because if you're going to look at a no-show report and you have even one or multiple patient accounts, you're going to see 4 no-shows for 1 patient. It's the same in our system as I believe for most of our competitors. In this scenario, though, we're still not recommending using a report to manage your no-shows. There are a lot of reasons why you don't want to do that. It might be crossing your mind, well, what else would I do? We're suggesting here that you use a tool. The tool is a setting within our system that automates a task to be opened up to the appropriate person on your team to make a callback. If there are 4 no-shows for your MD, your nurse practitioner, your chiropractor, and your weight loss, you don't want 4 tasks either. We're going to open a single task to say that that patient no-showed. And let's just say that patient left your office without a future appointment. They didn't have a future appointment with any of your specialties. We're still only going to open 1 task. And by some unfortunate accident that patient no-showed and didn't have any future appointments for all 4 of those specialties, we're still only going to open 1 task, consolidating those efforts to the right person, saying not only does this person miss their visit, but they don't have any future visits. This is a critical issue. We need to get this patient back on because they've got care left that they need to receive, and we need to show that we care about them by giving them a call. You can then actually run reports based on the actual tasks that are opened up in these categories, so you can see which patients are being affected, which ones are being followed up on, and you can create policies that your office can actually follow through with. I wish I could tell you I've seen every practice successfully reach out to every patient that has no-showed or just stop coming to their practice. It's not the case, but we do know that the efforts to reclaim a lot of those patients are worth doing, and they do get patients back through the door. And so your policy, though, has to have some sort of rigidity to it, where you text message 3 times, you call 3 times, and you email 3 times, and then you wait 6 weeks and you try it one more time. And then let's just say after that you actually discharge the patient as lost. Any way you look at it, after 4 weeks or 30 days, they're going to come back through the door, and you have to treat them as a new patient anyway. An eval needs to be done. So we want you to use those tools for those multiple specialties, as opposed to the unreliable nature of any type of report to follow up on. Really specifically, then you can actually use some of our appointment detail reports if you want to do any in-depth analysis on the efficacy of your current processes. And lastly here, under management, this is one of those topics where you as a practice owner or as an office manager, or even a front desk person, you want to have some control. If you're talking about this from a billing perspective and there's a problem with a patient account, managing that patient account in a singular situation is super easy if there's one of them. You update the payer, you apply it to the date of service range that you want to apply it to, you update the claims that are affected, and you get on with your life. You want to update the setting for contacting that patient. Let's just say they've got a new cell phone number. You update it once. You don't have to remember to do it in the 3 other accounts. We need to make managing the processes that you follow to schedule, bill, and document these patients easier. And Verical has thought long and hard about those problems that we discussed in the beginning and the best ways to go about solving those. We didn't do them on our own in a vacuum. We did them with practice owners across all sorts of different disciplines to make sure that the recommendations and the implementation of which were there to serve you and the patient experience. That second part was something we just went over. For you, managing that practice, looking at those reports can be really, really problematic. If you have the ability to look at the work that needs to be done as opposed to a report of work that could possibly be assigned, you have a much, much different perspective on how to manage that office. You know which employees are making the phone calls to the right patients and which ones aren't, because you can actually look at the work that's being recorded as opposed to the result of the patient. And in this particular instance, you can say, all right, the work we're doing is or isn't working, and you can make changes. that no accidental scheduling or billing of the wrong account, I don't want anyone listening to this to hear that as an understatement. It's a real pain in the neck if you're not going to be able to accurately bill out and track the patient status as well as the outstanding status to insurance, should you have that, of what's happening at the patient account level. We put no increase in cost here because our pricing typically for a single specialty account versus a multi-specialty account, and when I mean typically, I mean 99% of the time, is the same. The only time that's ever really different is if you have a lot of different specialties at multiple different locations. We typically come up with customized pricing to accommodate that. But if you've got, let's just say, 3 locations and 4 specialties at each location, the pricing you see on our websites, it applies to you. If you've got 21 locations with 6 different specialties at each one, it might not apply to you. We're going to have a conversation about that. But we'll keep it reasonable. And then the last thing is as this trend of having the patient at the center is being encouraged by insurance companies. They're incentivizing for patients to get fixed at one location at the same time. It's happening. We know that patient wellness is starting to be taken more seriously by insurance companies, which is suspicious, but exciting. We know that all of those people who are really considering or contemplating moving to this model, you might wonder, hey, how am I going to implement this? Now, we're not going to tell you from a tax structure how to do it. We're definitely not going to tell you what codes you should be billing, but we will help you implement this from a tracking and management perspective in your practice. We have experience doing this now over a couple hundred practices. We've done this and we're happy to help you. So if you have more questions about it, you simply would need to let us know, open a ticket, make a phone call, and we will get back to you and help walk you through it. And that was really the content for today. And over the next few weeks, we'll be continuing to add demonstrations of each one of these sections so you can kind of see how this is going to work. So not next week, though. So we'll start in 2 weeks with that. So if there are any questions right now, we ask that you type them in. We'd be absolutely happy to answer them. And after a couple of minutes, if we don't have any questions about the main topic, we always open it up to any topic that anyone wants to talk about.
So if anyone does not see the chat box on the left-hand side, at the top left, there should be a button that says Show Chat, and then you will have the chat box for any of your questions.
Perfect. Yeah, we've, right now for the month of March anyway, out of the, a lot of new practices, over a third of them were multi-specialty that signed up with us. I didn't look back historically, but right now, over 25% of our practices that are with us are multi-specialty. So this trend is picking up. So that's exciting. If there are no questions about this topic, we're happy to answer questions about any topic, so just let us know. All right, well, if there are no other questions, I'd like to thank everyone for their time today, and have a great week.